Hi, I'm John McGready. I'm a teaching professor in the Department of Biostatistics. So I'm 2 months shy of 26 years. And I ended up here because I saw an ad in the American Journal of Public Health. I was working in DC at the time, looking for somebody to help with the educational programs in the department. I was a math person, but I always had an interest in sort of human behavior and human interactions, and I guess that sort of drew me to public health. And I had done, just sort of out of interest, some volunteer work in different situations and learning more about public health as it applied to different topics. And so I thought, given my math background, I thought that was a logical starting point, at least, to go into biostatistics to sort of get an entree into the world of public health. So I do a fair amount of teaching. I also do a fair amount of collaborative research with faculty from the school and the School of Medicine. I tend to be the stats person in their study. I've got some nice, lucky for me, long-term collaborations with folks from genetic medicine, folks from Bayview who are studying aging, which is something I happen to be experiencing. So it's good. It's good immersion. And I'm sort of help them. So they help me learn about their topic areas, and I help them with the statistics. A lot of these studies are observational and longitudinal in nature, so they require some finesse. So I am sort of an applied researcher in the sense that I help other people apply methods that already exist. I don't generally develop methods, but actually avail myself to ones that are both classic and modern, figure out when they're appropriate and how to use them, how to implement them with the computer, et cetera. But my biggest is helping people who have real substantive questions, helping them translate some of that into the statistical and implement it. So it's interesting. So when I was brought in, ostensibly one of the duties I was going to take on was to help coordinate transition from an existing course to the first online course taught by the department. And ostensibly, I thought I would be sort of a project coordinator, helping the faculty turn their course into an online offering. But I got a big break because they were not interested in doing that. They would want to continue to teach it in person. They didn't want to actually transition to the online world. And so I had my first course, which was the online statistical reasoning series, which I still teach, not the same version of that from 26 years ago, but that sort of was my foothold into the world of teaching introductory biostatistics to non-majors. And slowly but surely I took over the on-campus version of the course. I updated and changed the materials for the course moving forward. And I've taken on other roles teaching other introductory and intermediate courses as well. It's been an amazing place to grow in my career, grow in my education. I did my PhD here while I was working. I've always felt kinship with my fellow employees, faculty, staff, et cetera. Just the vibe of the department is really wonderful and conducive to being a lifelong learner. That's sort of the tacit expectation in a good way. So I just like the collegiality. I like the friendliness, and I like the sort of aura of you can do anything with this, go for it. Well, I'd say, cool. But in all seriousness, I'd say, there's a lot you can do with biostatistics. Sometimes people tend to think of us in one sort of silo or another, but it's a fluid, interesting discipline that involves mathematics, it involves science, it involves public health, it involves substantive knowledge or gaining substantive knowledge, it involves communication and working on communication. So there's a lot of different ways to have a career in biostatistics. And so, it's if you have interests in statistics, but also their applications, you have interests in communications, et cetera, you can sort of build a career emphasizing to different degrees the pieces of that you're most interested in.